in.
Hello, my name is Quinn. I'm going to be your family nurse practitioner student today. May I ask your first and last initials, please?
William G.
Okay. Hello, Mr. G. What brings you into the clinic today?
Just a checkup.
Okay. Mr. G, may I please obtain your permission to perform a gastrointestinal or an abdominal assessment?
Yes.
Thank you. Today we will be performing a gastrointestinal or an abdominal assessment on our patient today. I'm going to sanitize my hand as well as don my gloves. All right, Mr. G, may I please ask you to lie down for me, and I will be glad to help you. Thank you. All right. To start our abdominal or gastrointestinal assessment, I'm going to pull your shirt up. All right. Our first step is to do inspection. First, Mr. G, are you having any pain, tenderness, or discomfort in your abdomen?
No, ma'am.
Okay, thank you. With the inspection, you're going to be inspecting for any scars, lesions, abrasions, as well as any ecchymosis in the abdomen, as well as looking at the contour of the abdomen. And just by looking at the abdomen, there are no scars, no lesions, no abrasions, and no ecchymosis of the abdomen. Okay? Next, I'm going to assess Mr. G for a possible hernia. Okay? Mr. G, I'm going to come around on this side. May I please ask you to turn your head that way and cough for me? Okay. One more time. Good. For the patient, to maintain the patient's safety, you would look in the inguinal or the groin area for any inguinal hernias by asking the patient to do the exact same thing, having them to turn their head and cough while observing the groin areas for any possible hernias. However, to maintain the patient's privacy, we won't be able to do that today. However, the abdomen is negative for any hernias. There were no hernias observed by the patient's coughing, okay? For the sake of the patient's safety, I will place my hand in the groin area and ask the patient to cough. May I get you to turn your head that way and cough for me? Good. Alrighty. One more time, please. And based on me just lightly laying my hand over the inguinal or the groin area, there was no hernias felt when the patient did cough, okay? Next, we will be auscultating all 4 quadrants of the abdomen. Again, Mr. G, I have to ask again, okay? Are you having any pain or tenderness in your abdomen anywhere?
No, ma'am.
Okay, thank you. We will be listening in all 4 quadrants of the patient's abdomen for 1 full minute to note our bowel sounds. We're going to start with the right lower quadrant. Okay, next we will go up to the right upper quadrant. Next, we'll go to the left upper quadrant. And lastly, our left lower quadrant. He does have active vowel sounds in all 4 quadrants. Next, we will be listening or auscultating for any bruits. I'm going to let my umbilicus be my midpoint. I'm going to go 1 inch above and to the right to listen for any renal bruits. And again, letting my umbilicus be the midpoint. Again, 1 inch up and to the right or left, listening again for a renal bruit. Letting again my umbilicus be the midpoint, going down 1 inch and to the left for an iliac bruit, listening for it. And again, 1 inch down and to the right for an iliac, listening for an iliac artery bruit. Last but not least, we will, for the sake of to maintain the patient's safety, I'm just going to indicate that we will listen for a femoral artery bruit in the inguinal areas. However, it will be best to listen to this with the stethoscope against the patient's skin. However, to maintain the patient's privacy, I will listen on top. Again, in the right inguinal area, listening for a femoral artery bruit, as well as on the left. And again, the best way to listen for it will be the stethoscope against the patient's skin. However, to maintain the patient's privacy, we will do so on top, okay? Next, we will be percussing. With percussion, we're going to be percussing for the liver. We're going to notate the measuring the span of the liver. We're going to be percussing the spleen. We're going to be percussing the kidneys, costovertebral angle, as well as percussing the patient's abdomen for any ascites. So when you start to percuss for the patient's liver, you can go mid-clavicular line, which is where you will start, and then lightly percuss down, listening for the change in the sound. I'm going to lightly tap to measure the span of your liver, okay?
Okay.
Thank you. And the span should be between 10 to 12 centimeters, okay? Next, we will percuss for the spleen. On the opposite side. Listening for the changes in the sound, we percuss the spleen. All right. Next, we will percuss. Since we're at the abdomen, I'm gonna show you how to assess for ascites. If you have a patient that suffers from cirrhosis, a lot of time, or some type of liver failure, they have what we call ascites, meaning a fluid buildup in the abdomen, okay? The abdomen is swollen, and with the palpation, percussing the patient's abdomen, you will have a very temporal sound, okay? As where the fluid buildup is. On the sides, it will be a very dull sound. Another way you can assess the sound when percussing is having the patient turn on their side, where this will be dull, but the sides of the abdomen will be very temporal, indicating for the fluid buildup. And again, that's in patients that does suffer from ascites, okay? Mr. G, do you mind if I ask you to sit up a little bit for me? And I'm going to get you to face the back, okay? All right. Next, we're going to percuss. You can sit up straight. Next, we're going to percuss the costovertebral angle. You're going to feel for that last rib and the spine. And you could percuss there. Any pain there?
No, ma'am.
Any pain there?
No, ma'am.
Okay? And for the kidneys, which is literally right behind that last rib and just below that costovertebral angle, by percussing, any pain there?
No, ma'am.
Okay. And any pain here?
No, ma'am.
Good. If there was any pain or tenderness notated to the kidney area, that will be an indication of pyelonephritis or urolithiasis. Both are indications of an infection, and some intervention is definitely needed, okay? All right, Mr. G. Next, I'm going to, because I'm already here, I'm gonna ask the patient to lie back down, and we are going to palpate. Thank you. We're gonna lightly palpate first, and then we'll deeply palpate, okay? First, we're going to palpate the abdomen. Starting on the left lower quadrant, our descending. Before I start to palpate, any pain or tenderness or discomfort that you're feeling right this moment?
No, ma'am.
Okay. I'm going to use the one hand for our lightly palpate. Starting at the descending colon. Any pain?
No, ma'am.
Okay. Any pain or tenderness?
No, ma'am.
All right. Any pain or tenderness?
No, ma'am.
Any pain or ascending colon? Any pain or tenderness?
No, ma'am.
As well as the cecum. Any pain or tenderness?
No, ma'am.
Okay. Next, I'm going to deeply palpate by placing my left hand over my right hand and deeply palpate all four quadrants again. And then we're going to palpate for our liver, our spleen, our kidneys. We're going to palpate our Murphy sign as well as our abdominal aorta. Starting at the left lower quadrant. Any pain or tenderness?
No, ma'am.
Left upper quadrant. Any pain or tenderness?
No, ma'am.
our liver, I like to stand at the patient's head and lightly, deeply palpate. Okay? Feeling for that border of the liver. Okay? Any pain or tenderness there? And I do feel it.
No, ma'am.
Alrighty. And then we're gonna come over to our spleen, to the patient's left, feeling for the spleen. I do have my left hand here on the back supporting, okay? Any pain or tenderness there?
No, ma'am.
And you can also assess for the kidneys as well. And then you may not feel them. Okay? Take a deep breath for me. Any pain or tenderness there?
No, ma'am.
All right. While I'm at the patient's head, you do assess the liver this way. However, you can also assess the patient's for Murphy's sign, that's where it's on this side as well, or you can stand at the patient's side or at the bottom. However, it is on the same side. What you can do, ask the patient to, you're gonna feel here or in the patient's right upper quadrant. Ask the patient to take a deep breath. May I ask you to take a deep breath, please? Any pain or tenderness there?
No, ma'am.
Okay. If the patient would notate any pain or tenderness there, that could be what we call a positive Murphy sign or cholecystitis, meaning there's an infection in the gallbladder, okay? Next, we will palpate for the abdominal aorta. At the umbilicus, you will feel, always with your middle and ring or your index and your middle. Never use your thumb because you do not want to feel your own pulse. And if you're moving 2 inches to the left or to the right, you should not feel a pulse. But if you go back midline, you should feel a pulse. If you feel a pulse to the right or to the left, 2 inches away from the midline, that could be an indication of an abdominal aortic aneurysm, and intervention is definitely needed, okay? While we're here, Mr. G, I'm going to assess your abdominal reflexes, okay? I have a Q-tip, and I'm going to lightly strike the patient's abdomen, rubbing, and to assess for any abdominal reflexes, okay? Okay. Okay. And when you assess the patient's abdominal reflexes, you're looking for the synchroning with each strike of the object that you're stroking the patient's abdomen with. Any event that you have any decrease in the reflexes, it could be seen in patients that are either obese, and it could also be seen in women that has had multiple pregnancies, okay? I'm gonna pull your shirt down, and I am gonna help you up. Thank you. Mr. G, are you having any pain or tenderness right now?
No, ma'am.
Okay. That will conclude our abdominal or our gastrointestinal assessment on today. Did you have any questions or concerns that you'd like to address today?
No, ma'am.
Okay. I really want to thank you for allowing me to perform an abdominal or a gastrointestinal examination on you today. I really appreciate it. If you have any questions, any concerns after our examination or your visit on today, please don't hesitate to call our office or set up an appointment, and we'll be glad to address any questions or concerns that you may have. Okay, thank you. Again, that concludes our gastrointestinal or abdominal assessment. Thank you again.